truly an honor, and I wanted to share with you some of my thoughts regarding regenerative medicine, specifically with mention to the whole world of peptides. Peptides is something very near and dear to me. I have been in this arena with regenerative medicine since 2012. And my former life, I was a surgeon. I did well over 15,000 surgeries. And the reason why I became fascinated with this area was because I incorporated regenerative medicine in my surgical wound healing. And I found that there were amazing results. After doing a surgery, patients would walk in 2, 3 weeks after, and it would be very, very difficult for me to find the suture line. And I realized that, there is something more to it than there's a science that we're just basically scratching the surface of. My curiosity and interest peaked when my desire to preserve my parents became really something near and dear to my heart. So my dad got to 99 and a half years of age, and my mom, I got her to 93 years of age. My dad fell, hit his head, and unfortunately, I was trying to get him to the 100 plus. But anyway, I got him to 99 and a half. So I wanted to share with you some of the technologies that I used for myself personally, especially with the peptides, as well as what we do in our current clinical practice. I now teach globally, and I want to share with you some of what is being done in other parts of the world. Sadly, we have not been necessarily up to par with some regions of the world in terms of the peptides, but we are catching up fast here. And let me share with you some of the frequent questions that I get. One of the things that I'm asked all the time is, what is a peptide? And I think it's a fascinating question. In my world, I say a peptide is a biological messenger. The oldest peptide is, you all know it, it's insulin. It was identified in 1921, and then by 1923, it became commercialized and started to be used for diabetes type 1. And thereafter, multiple other peptides were identified and utilized, one of which in the 1950s was oxytocin, which for obstetrics, we use it for augmentation of labor and to help with, if there's a delayed labor, we help with that. For surgery, another one came out called vasopressin. We use it to help to suppress bleeding and to get a nice surgical field and to decrease blood loss. And it evolved thereafter. So in your mind, you can think of a peptide as a biological messenger. It's telling your body what to do. If I give you insulin, it's telling your body to decrease your glucose level. That's what it essentially is. And you may say to me, well, are peptides safe? I say to you, yes, they are safe, but we have to always remember it's safe in the hands of medical supervision. Okay, so peptides versus, say, a conventional medication. I like the analogy of a lock and a key. The peptide, say for example, insulin, that key is going to unlock the peptide lock, and is specific for the receptor. So if you tell the receptor, if you give the peptide, it's going to unlock it with minimum side effects. Now, let's compare it to, say, a traditional, conventional pharmaceutical agent. Let's give you, let's say, an NSAID, ibuprofen. Ibuprofen, yes, it's going to decrease prostaglandins. But in the process of decreasing the prostaglandins, it's going to have negative effects on the kidneys. You're going to get side effects if I take it for a long time. It's also going to impact the gastric lining. So if you take it for a prolonged period of time, guess what? You're going to end up with gastric ulcers. And the list of complications can continue thereafter. So Whereas if I give you a peptide in a medically supervised manner, my expectation is that my side effect profile is going to be significantly less. And remember, these are agents that have a short half life, the effects are controllable, and they are mimicking naturally occurring molecules that are originally in the body. So let's give you an example. Insulin is naturally occurring in our bodies. The pancreas releases it, and the pancreas releases insulin. The very popular peptides today, we all hear about the Ozempics of the world. Well, that falls under the umbrella of what we call incretin, Incretin peptides. These are peptides found in our intestinal tract. So, in summary, they're often very well tolerated, and we can give them in low doses because all I'm doing is increasing the dose naturally of something that's naturally being created or being produced by the body. Now, you may say to me, well, what are the negatives to taking a peptide? Well, of course, some peptides we know uh, are not necessarily FDA approved. Okay, so for human research only, um, I want to always preface that when I discuss with my patients, clients for research only, it's something that we have to um, always be very upfront and to disclose that to the patients. Um, but apart from, and then for me personally, because I take peptides, you can get localized skin reactions. You can get a localized irritation from getting using the peptide. You may get a little burning in the area, mild headache, or even some fluid retention. Now, some peptides you may get an occasional nausea, especially the GLP-1 peptides, peptides like um, Ozempic, the Mounjaro, those type of peptides can give you, if taken in high doses, you can get nausea from it. So I want to stress that you want to use these agents when you have a medical supervision taking place. So, another common question that I get is which peptides are best for losing fat as well as for longevity? And I'm going to tell you my favorite one is the retatrutide. Retatrutide, the reason why I like that peptide, it has three mechanisms of action. It focuses on three receptors. One, the GLP-1, another one called GIP, as well as glucagon. What does that mean to us all here? It means that this peptide versus, say, Ozempic focuses on the GLP-1. This peptide, I like it because you have preservation of the muscle. So, someone like me, I used Ozempic for 10 months, lost 65 pounds. But you know what was my problem? My problem was that I started to lose muscle. And in the process thereof, I started to have temporal wasting. And to be honest with you, my better half thought that I ended up looking like someone who had a malignancy. Okay. So as a result, I had to now implement another peptide to start to build muscle, right? The CJC, which we'll talk about later. So the beauty of retatrutide is that you won't have to do that. This peptide has the three mechanisms as I just discussed, and you're going to have preservation of your muscle. Okay. Now, other peptides that I like for longevity, one is called CJC1295, and this one is stimulating the growth hormone. And by stimulating growth hormone, we are going to build muscle mass as well as um, the tone of the muscle. So this is a very good longevity peptide. Key thing to note, the peptide is not exogenous, meaning I'm not giving you growth hormone. I am giving you something, a peptide that's going to stimulate your body to release more of your natural growth hormone. It's very important to know because I'm not giving you something exogenous, something made in a lab or an animal based growth hormone product. No, I'm giving you a peptide that's going to stimulate your pituitary gland to release more of your growth hormone. Another key peptide that I love for longevity is this one called GHK copper. Why do I like it? I like it because it stimulates tissue repair and collagen genes. So, for me, I use it also for my hair loss and for facial tightening. If I want to, you can see my hair is kind of falling out now as age, but I refuse to have that happen. So there are medical studies to show you that if you use the GHK copper, not only will it be ideal for collagen and elastin, it actually helps us, both male and female, with hair follicle support. You can give it subcutaneously, but you can also give it microneedling it into the scalp, which is what I do for myself. Another popular peptide that I believe in, it's called MOTS-C, MOTS-C. And you're going to ask me why? Well, think of our cells. Our cells and inside the cells is a power plant that makes ATP. That's the mitochondria. If I want to maximize the efficiency of my mitochondria and my powerhouse, I'm going to give MOTS-C. MOTS-C is one of the mitochondrial peptides to help with efficient production of energy. So let's give you a clinical example. Someone who wants to optimize their workout in the gym. I had an athlete this morning came in. He was saying he's just very lethargic. He actually had an overdose of testosterone. So he was feeling lethargic. He just didn't feel good. Could hardly do his workout this morning. However, he started MOTS-C. And he said, guess what, doc? That MOTS-C has been helping me tremendously to complete my workouts. So how are we giving it to him? Twice a week, 5 milligrams subcutaneously. And what is it doing? It's called an exercise mimetic. It's helping him to optimize his workout. So I know those of you listening, you're thinking, okay, if it's good for energy production, could we stack it? Can we use it with other peptides? And the answer is yes. So imagine, say, yours truly, what do I want to use for myself? Well, I certainly don't want to gain more weight. So what will I do? I'll give myself a low dose of retatrutide, maybe once every 3-4 weeks. But I'm going to also give myself MOTS-C twice a week. And the ideal scenario is that I'm going to be maintaining my metabolism, right? I'm trying to control my metabolism, my glycemic index, but also I want to maximize my workouts when I meet with my trainer weekly. So that's something for longevity. Another one, pardon me, is epitolon. Epitolon is a peptide that has 2 protocols. What it does, it focuses on the telomerase on the DNA. Think of it as we age. As we age, the DNA starts to unravel. And if we have the telomerase protection, we notice that if we protect them, the unraveling process slows down. I'm making it as simple as possible. But that peptide called epitolon is very, very good in terms of supporting the telomere. And by supporting your telomeres, that's going to help me with slowing down age. Now, there are 2 protocols. There's a Ukrainian protocol and there's a Russian protocol. What I like is that both this peptide can be given every 6 months. And as I mentioned, it's minimizing the unraveling of your DNA. And if you're decreasing the unraveling of your DNA every 6 months, that's a perfect plan to decreasing the issue related to aging. Now, I alluded to another question that I get frequently asked. How are peptides taken? Most commonly, remember, the stomach is the harshest, most hostile environment in the body. That's where we have the gastric acid. So if you take a peptide, usually it's going to be dissolved or destroyed by the gastric acid. So most peptides are delivered subcutaneously via a needle, like an insulin needle. Now, modern science has evolved to the point where there are certain enteric coated products. Yes, someone is showing me on the screen. Epitalon, excellent. I'm impressed. So we'll discuss it at the end, but absolutely, you are definitely wanting to live long. I believe in it. So the peptide most times is delivered subcutaneously using insulin needles, but some of them can be delivered via the oral route. One of them is BPC 157. And I want to share with you all, I'm sorry for these terms, BPC, it's certainly confusing to the mind. Body protection compound 157. It's not like you can say Advil or Motrin or Tylenol. These words are a little complicated. Do forgive me, but we'll get through this. BPC 157 was actually identified by a Croatian scientist. And that peptide protects the gastric lining from the gastric acid. Imagine this. If I give you that peptide and I deliver it in any area of the body, guess what? It will have anti-inflammatory actions. So I can inject it into your shoulder joint. I can inject it into the bladder. I can deliver it to the gastrointestinal tract. Or for neurological indications, someone who has had a stroke, for example, just to name some of the indications for this peptide. So we will discuss this further as time permits. This is just a little chat tonight, but we can delve into more of these issues in other webinars, and we're going to have a workshop later on in the month. But remember, BPC is one of my favorite peptides. Peptides can also be delivered via a nasal spray. Believe it or not, I like to deliver peptides via that route for conditions that are neurologically based. For example, anxiety. You can give patients nasal applications of a peptide called SELANK, SELANK. For those who have early onset dementia, CMAX, SEMAX. Love those peptides because they both work extremely well and have significant clinical positive effects. Topical, I like GHK copper, which we just discussed, for fine lines, for wrinkles, and for the hair. Now, I get a quick, very common question is, what about peptides for injuries and recovery? What peptides would I use for that? And the peptides that I would use, top of the list would be BPC 157, which we just mentioned. And there's another one called TB500 that you just showed me. I like it because it promotes tissue regeneration, it improves muscle recovery, as well as cellular repair. And of course, GHK copper, that stimulates collagen production and also skin healing and tissue healing. The other one you just showed me was a TA1, thymosin alpha 1. Now that one, I like it because it's really good for immune protection, and that one works really with the T cells and helps boost natural killer cells. So I really am a very big fan of those peptides. what else do I, what other questions have I been asked? So the description I wanted to share with you in summary was, what's retatrutide? We discussed it. We said retatrutide, for short, is one of my favorite peptides. It's the incretin peptide with 3 mechanisms of action. That's a take home. Why? Because if you want to lose weight, that's a peptide you would use without the risk or minimal risk of muscle wasting. CJC 1295, popular one because it's going to be stimulating the brain to release that growth hormone and get that muscle mass and help me to get muscle mass as well as the tone. The BPC 157, popular for anti-inflammatory effects, GI positive effects. Also, if I have a wound, I definitely would like to consider this because it's going to increase blood flow to the area. Remember, if you have patients or loved ones who have had a stroke, this is something really good because I tell you, for my mom who had a stroke, what I did, I gave her intranasal BPC, Cmax, and I was also able to give her another peptide called cerebrolysine. So after she sustained this stroke, she didn't remember me. She didn't know who I was. And as a result of that, I gave her those peptides along with IV exosomes. 10 days later, mom was walking, brushing her teeth. She knew who I was, and her face was no longer twisted. So when I tell you I'm a believer of this technology, I am. And I'm a living, walking example because I myself was personally a diabetic, type 2. And after taking the semaglutide for 10 months, not only do I not take any medications, I'm off of it. Now and then I may take, if I'm going to go on a trip with my fiance, I may take 0.25 of Areta just to make sure, because I'm going to cheat. I know I'm going to have the desserts, so I don't need that problem. Hey, we all are human. So I make sure that, well, guess what? Fatty liver. I had a fatty liver. I had sleep apnea. I was diabetic. My hemoglobin A1C was 7.2. I had osteoarthritis of my knees, sleep apnea, and gout. My friends, I'm here to tell you, all of those conditions are gone. Thank God. And now she and I can run through the airport. I can jog through that airport without losing my wind. And the fatty liver was resolved again because of the GLP. So the GLP-1 is incredible. So peptides are the way of the future in my mind. Another popular one that I really love is the thymosin alpha 1. Why? Because it's immune modulating. It enhances the T cell function, immune responses. So suppose you have someone who is suffering from the COVID, post-COVID, viral issues. It really helps you to regulate inflammation. So if you have an inflammatory condition, like, for example, inflammatory bowel disease, Crohn's, ulcerative colitis, those type of conditions, an autoimmune problem, think about, we say TA1, thymosin alpha 1 for short. And I'm going to leave you with, I'm not saving the best for last, pardon me, but PT141. PT141 is a very popular peptide, my friends. Why? It acts on the melanocortin receptors in the brain, and it increases sexual desire and arousal in both men and women. So for my male patients, what I do, I actually use it for some of my patients because it also acts on the genital area to increase and address erectile dysfunction. For those who are no longer able to get the benefit of Viagra or Cialis, I actually add PT141, and it's a synergistic effect because the PT141 is working on this at the central level on the melanocortin receptors. Different approach to the versus the Viagra and the Cialis, which is working on the vascularity. So PT141 is very popular for me, and it can be given in conjunction with other agents. So I want to leave you tonight with that favorite peptide. I want to remind you that we're going to have these webinars on a regular basis, weekly. We're going to be doing a really deep dive into the whole world of peptides. I'll be able to share with you and bring back to you what we are discussing globally. Other countries like Argentina, Brazil. Brazil is actually way ahead in terms of injecting these peptides into the brain as well as into the spinal cord to help people to walk again, because the peptides are helping with synapses and neuronal synapses. So it helps with stroke victims. Tremendously positive things that I'm going to be able to share with you. So thank you for your attention. I look forward to listening to you and hearing your questions. I'm here for you. So I'm going to open up the floor to you all now. Any questions? I'm happy to answer.
So, Dr. Chris, I just want to say thank you again for coming out and doing this presentation, and thank you for everybody that showed up. I know Stacy's invited quite a few of you out here today. So, but yeah, here's a floor, here's an opportunity, guys. You have the attention of the doctor. I know, Doc, you had mentioned something about the nasal spray and how it helped dementia patients earlier. Could you mind touching on that just a little bit? Because I know that there's somebody on the call who has a child with Down syndrome, and she's starting to experience these, and they're looking for alternatives or ways to help. So maybe you could touch on that.
Yes, so that's a really good question. So I would recommend just in general, CMAX, SEMAX, nasal spray is something that has been shown to increase something called BDNF. BDNF is very important with synapses in the brain. It's going to help to decrease the progression of the dementia. That peptide is definitely key. There's another one called cerebrolysin. Difficult to get that one, but certainly something that needs to be pursued. Why? Because it comes from the frontal lobe of the pig. And what it does, it has neuropeptides and also helps with the synapses. It comes out of Germany and Austria. The name of the company that makes it is Eva Pharma. Phenomenal results. And another peptide I would like to recommend, which good news, is oral. It's called dihexa, DIHEXA. Now, dihexa can be obtained through as a supplement, which is good. It's available here in the US from a company known as Healthgevity, HEALTHGEVITY, Healthgevity. And they have the dihexa oral supplement. You take it 10 milligrams daily. Excellent results, because again, it's helping. So you notice that I'm mentioning multiple peptides because each one has a different mechanism on the neuronal system and on the central nervous system, and they work synergistically with each other.
Thank you, Doc.